We have before us SB 635 by Senator Menjivar concerning healthcare coverage of hearing aids.
Thank you, Madam Chair. Good morning, everyone. I'm here to present to you SB 635, the Let California Kids Hear Act. You've probably seen little kids with this white shirt on their front saying let them hear. This bill has enjoyed bipartisan support. And it's a bill to rectify a program that hasn't been working for the past couple of years. A previous assembly member was looking to ensure that our kids, our youth, got coverage for their hearing aids because they were screened. A bill had been passed for kids to be screened for hearing loss or hard of hearing, but that's as far as it went. As a parent, with a newborn, you're told that your child is hard of hearing or won't be able to hear, but then you're not offered the support to purchase these hearing aids that can range up to $3,000. There was a previous bill attempting to rectify. However, we rerouted to see if the department could address this issue. The department has gotten so much money to address this, and yet has only been able to serve in the low hundreds out of the tens of thousands children and youth who are eligible to get coverage for hearing aids. On top of that, there are so little providers who participate in this because of the lack of reimbursement for this service. So to ensure that the children you see today get the coverage to get hearing aids, to be able to address what experts have called a developmental emergency, we need to ensure that we get SB 635 passed. To that, I want to turn it over to my witness, who can speak a little bit more. A mom who stopped everything to start a nonprofit to dedicate her time to ensuring that her child and the rest of the thousands of children in California have access to hearing aids. So, Madam Chair, with your permission, I'd like to introduce Michelle. What is Michelle? Your last name? Marciniak.
Yes.
I'm really bad. I'm so sorry, Michelle. We've worked so hard on this. A co-chair and co-founder of Let California Kids Hear and co-sponsor of SB 635.
Good morning. Please go ahead.
Good morning. My name is Michelle. I'm co-founder of Let California Kids Hear and a co-sponsor with Children Now of SB 635. I want to thank the 50 organizations who have signed on, the parent advocates here, and all the legislature who has always stood with our children. My husband and I found ourselves in a support group in LA one evening, grieving that our daughter hadn't heard us say "I love you" in 6 months or the bedtime stories we read at night. We were quickly humbled as we could afford hearing aids. And every mom's story thereafter was about devastating financial decisions that they were making. The fourth mom said, "I have 5 kids, our family's not going down, he'll go without." I started interviewing more people and went to the No Limits for Deaf Children center, and they said children were showing up at the age of 5, right before they were supposed to go to kindergarten, unable to say their name because they had never heard it. I was working at Children's Hospital Los Angeles at the time and went onto the cancer unit, and the drug that saved a child's life also took their hearing. And then, as they called their health plans, were told it is elective for your child to hear. Hearing aids cost $6,000. It puts a tremendous strain on so many hardworking families to find thousands of dollars to pay for the hearing aids, delay time-sensitive treatment, or forego them altogether. We're asking for your renewed support to adopt the original solution, a pediatric mandate to address a developmental emergency that's been unfolding for 25 years in the state of California. These costs are not only devastating the child and the family, but they're costly to society. It costs $1 million for every child that doesn't get early intervention in special education, other medical complications, and other costs. The state is currently spending $400 million a year to educate deaf and hard of hearing children. The absence of a solution is costing taxpayers billions of dollars by failing to provide early intervention. In 2019, the legislature passed the Let California Hear Act by unanimous consent. Governor Newsom pulled the bill back and offered an alternative program. And I'm so sorry.
And we'll need to wrap up, okay?
Okay. 30 states cover it. We are trailing southern states now. SB 635 is a responsible deployment of state resources. The potential $11 million cost will be offset by the $13.4 million for the HACCP program that you guys allocated. It is a fix that would address this developmental emergency that's been unfolding for years in the state of California. It would help 20,000 children. California's children and families are struggling and they can't wait any longer. I want to thank my daughter who told me this morning this isn't done until every child is covered in the state of California. Thank you very much.
Thank you very much for your advocacy and passion. Anybody else speaking in support of this bill? Now would be the time just to come forward.
Nora Lynn with Children Now, proud co-sponsor and support.
Thank you.
Nikki Feinstein, mother of a 6-year-old hard of hearing girl who wears hearing aids. We've been fighting this since she was 1, so I ask you to please let California kids hear.
Thank you.
Good morning, Madam Chair and members. Nick Brokaw from Sacramento Advocates on behalf of the California Academy of Audiology and Support.
Thank you.
Dr. Didi Biscuiti, UC Davis Medical Center, pediatric ENT, in support of this bill.
Thank you.
Is this on?
Yeah, go ahead.
Okay.
We hear you.
My name is Elijah Schuler, and let California kids hear.
Thank you, Eli.
Hi, my name's Avery, and it's time to let California kids hear.
We agree, Avery.
Hi, I'm Caprice Schuler, mom of Avery, and I support SB 635.
Thank you for coming.
My name is Johanna Wonderly, mother of 4 hard of hearing children. It's time to let California kids hear. You want to say something? Let California kids hear?
I'm Caitlin, and
Let California kids hear?
let California kids hear.
Yay!
Go ahead.
I'm Cassie, and let California kids hear.
Thanks, Cassie.
I am Kara, and let California kids hear.
Yeah.
Hi, good morning. My name is Marisela, and I'm a hard of hearing adult. Most importantly, I was a hard of hearing child whose parents unfortunately did have to bypass those hearing aids, and so I know the struggle. This is my son Mateo. He's hard of hearing as well and needs both hearing aids, and I refuse for history to be repeated.
Thank you.
You want to say something in Spanish?
Hi, I'm Mateo, and let California kids hear.
Thank you, Mateo.
Hi, Alex Smith, a mother of a hard of hearing son, Sayer. He needs his hearing aid to thrive, and it's for his safety as well. So please let California kids hear.
Thank you.
Hello, I'm Denise Kyles Jensen, mom of 2 deaf boys, 14 and 10 years old, and this is her 4th.
Thank you.
Hi, I'm a mom of a deaf and hard of hearing child. I'm an audiology student and president of California Handed Voices, here in support. Please let California kids hear.
Thank you.
Hi, my name is Lauren Dang. I am a mother of a 5-year-old son who is hard of hearing. Please let California kids hear.
Thank you. Okay, anybody speaking in opposition to this bill? Anybody not want California kids to hear? All right, seeing none, we'll go to the phone lines.
Ladies and gentlemen, if you wish to speak in support or opposition, you may press 1, then 0 at this time. We'll be going to line 24. Please go ahead.
Good morning, Sandra Poole on behalf of Western Center on Law and Poverty in support.
Thank you.
Next, we'll go to line 33. Please go ahead.
Madam Chair, members of the committee, Brandon Markey with the California Medical Association in support.
Thank you.
Next, we'll go to line 15. Please go ahead.
Good morning. This is Sarah Kaminsky with the Association of California School Administrators in strong support. Thank you.
Thank you.
Next, we'll go to line 22. Please go ahead.
My name is Raquel Lipset. I am a parent of a hard of hearing daughter that was not able to get hearing aids until 2.5, and I saw the detriment of that. I support SB 635, like California kids here.
Thank you. Next caller.
Next, we'll go to line 13. Please go ahead.
Hello?
Go ahead, please. It's on.
Mercedes Montalvo, physician and parent advocate and support.
Thank you. Next caller, please.
Next, we'll go to line 25. Please go ahead. '25, your line is open. Next, then we'll go to line 31. Please go ahead.
Hi, Erica Lopez, parent of a daughter who is hard of hearing and support.
Thank you. Next caller.
Next, we'll go to line 14. Please go ahead.
Hello, Janelle Ocampo, proud parent of two hard of hearing girls. Age is 8 and 16, and both of them who have hearing aids. One did not receive them until later in life, and one was provided hearing aids earlier in life, and I have seen the great benefit.
Thank you, ma'am. Thank you.
So I ask you.
Okay, thank you. Next caller, please.
Next, we'll go to line 12. Please go ahead.
Hi, Holly Gale, grandmother of a hard of hearing child, like California Kids here.
Thank you.
Next, we'll go to line 29. Please go ahead. '29, your line is open.
Next caller, then, moderator.
Yep. Moving on to the next one. They did just queue up, so one moment while their line number is given. And we'll be going to line 9. Please go ahead.
Hello, this is Amy Garcia, mother of a hard of hearing boy, and I support this bill.
Thank you. Next caller.
There's currently no one else in the queue at this time, Madam Chair.
Thank you very much. Now would be the time to bring it back to the committee. I saw Senator Rubio and Senator Grove wanted to speak. Senator Rubio.
Thank you, Madam Chair. Yes, I'm very proud to be a co-author of this measure. I know we've tried it in the past. And I want to just commend all the young little ones who came to speak here. That's, we're very proud of you for being able to come up and speak to the adults here. But I wanted to add my voice to a lot of the comments that the author made. And it's really important that we not see this just as a financial issue, and I know it was stated that the cost is $1 million in early intervention, but I want to share that. When I was a teacher, I had a 4th grade student who had a record that was very long of incidents with the principal in the yard. I mean, it went on and on and on. It wasn't until we figured out that the little boy could not hear, and he also had, he needed glasses, and the system did not catch it early enough, so he spent a lot of time in the principal's office and always misunderstood. Everything that he did was, misunderstood as behavior issues. But the reality is the little boy could not hear and he could not see. And so, without that kind of education early on in kinder, 1st, 2nd, and 3rd, by the time he got to 4th grade, he really didn't stand a chance. So we were so fortunate to be able to catch that early on when we got him glasses, we got him the hearing aids. He was a completely different child. By the time he left my classroom, he was really performing, where he needed to be. And I'm just sorry we didn't catch that soon enough. And so to all the children out there struggling, this is going to be a life-changing moment. And I also think for parents, it's, again, not just financial, the stress that parents have to deal with. I only imagine that parent every time the principal called to come in because the child was in trouble again. And so with that, you can't put a price on the peace of mind of the parents, making sure that the child has the education they need early on. I mean, the benefits go on and on and on. So I just want to thank the author and everyone here for advocating on behalf of our kids, our students. And with that, I will move the bill when it's appropriate. Thank you.
Thank you. Senator Grove.
Thank you, Madam Chair. I'd like to thank Michelle for advocacy, standing up for parents. I'd like to thank the author for bringing it forward. I do have questions, though, because I'm very concerned about the analysis and what it says. Obviously, we passed AB 598, which required health plans to cover hearing aids for children. It died, and then the governor instituted another program, hearing aid coverage for children program, the HACCP program. To date, they've gotten $16 million has been allocated, and they've only issued hearing aids to 225 children. That's a problem, and it's not a good use of money. who is going to administer this program? Please don't say the same.
No, it wouldn't. That's why we would retrieve from that program.
Okay.
And it'd be just a mandate on health plans because we've put so much money. You saw how much money, and we to get a bang for our buck, basically, if you will. So it isn't working under the administration, the department. So we're going to reroute that to be a coverage under a health plan.
Okay. Thank you. Thank you.
Thank you. Seeing no other members wishing to speak, let's bring it back to the author. You have a motion.
Oh, thank you so much. I would say, Senator Rubio, the CHPRB analysis also included coverage for Medi-Cal beneficiaries. However, in the state of California, Medi-Cal covers hearing aids, so that number is skewed a little bit. And I'm very thankful for the support that I've received so far, getting respect glass for your eye votes so that California kids can hear.
Thank you very much. And thank you to all the advocates and the parents and everybody who came out today to make a compelling case. And so with that, there is a motion, and the motion is that the Assembly amendment be concurred in. I'll have the Secretary call the roll.
Senator Eggman?
Aye.
Eggman, aye. Wen? Aye. Wen, aye. Glazer? Gonzalez? Aye. Gonzalez, aye. Grove? Aye. Grove, aye. Hurtado? Aye. Hurtado, aye. Limon? Limon, aye. Menjivar?
Aye.
Menjivar, aye. Roth?
Aye.
Roth, aye. Rubio? Aye. Rubio, aye. Wahab? Aye. Wahab, aye. Wiener? Aye. Wiener, aye.
That's 11-0. We'll keep the roll open for a little while. Next up, we have Senator Becker on